Welcome to Live with Hillsdale Hospital. Today is Wednesday, November 6th, and we're here to bring you all of the information about your hospital and healthcare right here in Hillsdale County. So we share that with our friends, our families, our neighbors. We're glad that you're with us today. We want to keep you up to date on what's happening around the county, as well as today around the state of Michigan. I'm your host, JJ Hodshire, President and CEO of Hillsdale Hospital, joined today by a very special guest and friend of mine, Adam Carlson. Adam is with the Michigan Hospital Association, Senior Vice President of Advocacy, and it's rare that we have such a celebrity like Adam on our program, but it's great to have you here, Adam. Why don't you tell us a little bit about yourself, a little bit of background for our listeners, and then we're going to get into the heart of some very important issues today.
Well, first of all, in my background, nobody's ever called me a celebrity, JJ, so I appreciate that. I'm originally from Dowagiac, Michigan, a small town over on the southwest corner of the state. Been with the Michigan Health and Hospital Association for 6 years now. And despite the title, it's really just a fancy way to say lobbyist. I'm a day-to-day guy here at the Capitol working on issues involving the state legislature and state administration.
Well, let's dive right into it, okay? We're gonna talk a little bit about politics today. And we're not going to talk about, specifically our views as much as we're going to talk about what's happening around the state of Michigan. So, I had a chance to be part of the Michigan Hospital Association Board of Trustees meeting yesterday. Man, just a ton of information about the changing landscape, both in Lansing and Washington. But, you're working primarily in Lansing. That's where you cut your teeth. Why don't you give us an overview about what's happening right now in Lansing? So the election comes in. What does that mean to us here in hospital systems, in our communities? And then talk a little bit about what's happening in current day with what's called lame duck. What does that even mean? Why don't you kind of take us through that?
Absolutely. So, the election is pretty much almost all the way over. Sounds like there might be one more recount happening at the state level. But for the most part, we know with certainty at the state level that the state house is going to flip control from Democrat to Republican. I think that's really noteworthy. Michigan is the only state with a legislative chamber that's going to flip control here in this latest election. Michigan has been under full Democratic control at the governor, the state Senate, and the state house for the last year and almost 2 years now. And so now we're post-election here, we're heading into what's called legislative lame duck. So that's one of those terms us political nerds like to throw around all the time. In reality, it's that time after the election, but before the new legislature is sworn in January. So that's when lawmakers are voting. There's not really a direct electoral consequence, and there's a lot of turnover. We had about 15 lawmakers who will be retiring at the end of this year or moving on to other jobs, with new folks coming in to backfill them, and they will all be coming in that January timeframe. In a legislative lame duck session in Michigan, at least, we have a full-time year-round legislature, and their session goes for about 2 years. So we're coming up right at the end of that 2-year session. So we've had thousands of bills introduced in each chamber. And at the state level, a lot of people, we tend to focus a lot on the presidency, the U.S. Congress and everything, forget about all the impact that the state level has on your life, right? And there's a lot of different areas, whether it's the roads, occupational licensing, agriculture, where the state has a significant impact. And obviously, in the line of work that we're in, JJ, healthcare, state legislation has a huge impact on healthcare and what that looks like. So in a normal lame duck session, there can be hundreds of bills, different types of things passed, and they can all have a huge impact on our daily lives going forward.
Yeah. So, lame duck, you've been around for quite a while in the Lansing area, and so you have watched lame duck come and go. It's best when lame duck goes, and it doesn't happen. But there's been there's a lot of political wrangling that goes on during lame duck, and I would guess in part because the outgoing representative, senator, whoever it is, maybe they want to push something through that they didn't push through first time because it wasn't popular, or their constituents didn't like it, and so. I would say, and I'm not asking you to say this, but I'd say it's probably one of the most dangerous times in which, you could see a lot of bad bills come about, and things that would never have been voted on during the constituency because they know where their constituents would lie with it. So with that, I want to jump into one of those that concerns me, significantly, one you've been working on, and one that we need to educate, our community on for speaking out. And reaching out to their legislative representative in both the House and the Senate. And Adam, that's what's called, minimum staffing ratios.
Absolutely.
And can you talk a little bit about that, what it means, the dangers, how we can, address those?
Yeah, so I think we've seen a new push on that here in lame duck, and their government mandated staffing ratios. And so what those are it's legislation from on high in Lansing that would create minimum staffing ratios for how many a certain type of licensed individuals would be on staff to care for patients. And we agree with where the intent of the legislation is. We need more nurses in healthcare, right? And that's really what it's focused on at the end of the day. And we are fully supportive of more nurses in healthcare. We've done a lot over the last 2 years to focus on that, to grow the talent pipeline and get more of those individuals out there. But the problem with something like a government mandated staffing ratio is it doesn't take into account all of the issues that go into staffing a hospital unit. It doesn't take into account patient acuity, how sick your patients are. It doesn't take into account how experienced your patients are. I think any nurse that you talk to will say somebody fresh out of school is going to be at a very different level, both clinically and just from an experience level, as somebody who's been on the job for 30 years and seen a lot of different things. And really at the end of the day, when you put in these arbitrary ratios in place, it just really treats employees like a cog in a machine where we have to shift them around and say, okay, you're moving over here because we have to meet this arbitrary ratio, even though we really need you over here in this place. And that's what the patients need and would be best for patient care to have you over here. But we're not going to be able to do that because the government knows best in this case.
Yeah. And Adam, you and I both know there are bad actors in any industry. And there's bad actors here in healthcare. We know that. They don't treat their staff like they should, but that should not be a standard by which we all are judged by and on. And if there are individual issues impacting an individual hospital, then they need to deal with that on that individual level, not a statewide, mandate and referendum from the legislature. But when we look at that, let me just break down some statistics. I want you to break them down because you have some of them. How many shortages do we have in the state of Michigan? How many openings right now are there for nurses? And paint that picture for us, because if it was just as easy as hiring nurses, JJ would have done that months ago, right?
Yeah, and this is just at hospitals. We have 4,700 job openings for nurses at Michigan hospitals today, right? So if they showed up in the state of Michigan, licensed and in good standing, Michigan hospitals would hire them. And that doesn't take into account all the other places that nurses work, like in nursing homes or insurance and other various areas. So what we do a lot when we're telling people and they're looking at legislation, we say, think it through, right? Think about what the impact you have and this is going to have if you vote on something like this, especially during a chaotic legislative lame duck session. And when you think it through, it leads to issues with access to patient care. So when you put in place these arbitrary limitations, we know in talking with our members and working with them and looking at the legislation that's been introduced, it would lead to 5,100 hospital beds that would have to be taken offline or closed. If this were to go into effect. And the whole reason it comes back to, like I said, it's just we need more people.
Yeah. And that's an incredible and sobering statistic to know that we already have this major shortage. Let's just say 5,000 open positions roughly. And now we have to find 3,000 more or 4,000 more. This made the problem much worse. And so I appreciate the work MHA has done, you specifically. What can the viewer do to say, you know what, that could close our hospital? How can we empower them, Adam, and give them some tips and what they can do? And moving forward, even from today in the next 20 minutes to a half hour, what action can they take?
I mean, contact your lawmakers. That's where it all starts. Politics is not a spectator sport, as we like to say. And one of my other favorite sayings with politics is you must be present to win, right? You have to make sure that lawmakers know where you are as one of their constituents, how you feel about these issues, and that you're concerned with the impacts of the votes that they are going to take. And a lot of them, especially the better lawmakers, they take that into account, right? They look at what the voice of their community says, and they say, yes, this is going to have an impact on my life. And I mentioned how many hospital beds that might have to close with something like staffing ratios. But I mean, that'd be the equivalent of closing the 6 largest hospitals in the state of Michigan if something like that were to go into effect. We want to make it as easy as possible to contact your lawmakers. There's lots of different ways. Obviously, with the Michigan Health and Hospital Association, you can go on our website We have an easy form you can fill out, and it can contact your lawmaker on a variety of issues. It can say, hey, I'm opposed to these government mandated staffing ratios. You could say you're in support of the 340B drug pricing program, which helps especially our rural hospitals be able to remain viable and offer the services that they provide. Or you can just do a generic one that fill it out with whatever other issue might be out there, whether it's maternal health or behavioral health, some of the things that we've been focused on in recent years, and contact your lawmakers, get in touch with them. They really do like to hear from their communities and their constituents, and they need that to help guide their decision making.
So Adam, let's look at the layout here. So we've got roughly a month and a half left until the calendar year concludes. But during any of that time between now and then, their legislature could meet again, right? And what is the likelihood of that happening? And what type of time frame are we talking about to push a piece of legislation like this through? It doesn't have to go through committee, help us understand that.
So there's very few actual rules that they have to follow in lame duck. There's something we call the 5-day rule that's in the Constitution. That means a bill has to be introduced and lay over for 5 days before it can be acted on in either chamber. And that's really the only hard and fast limitation. In normal times, the committee process is usually followed. There's usually opportunity for public testimony and more public input. Sometimes that can go away during lame duck, and we've seen that in the past where things get discharged from committee without a hearing, or they get moved a lot faster because of that. And like I said, the only provisions they have are those 5-day rules. The legislature, as of right now, there's a legislative day today, which is almost over at this point, but they have 8 session days between Thanksgiving and Christmas.
Oh, okay.
And that is the likely time frame when they're going to look at doing a lot of these issues. But there's so many issues, even more than just healthcare related. There's going to be a lot of focus on economic development during that legislative session too. There's going to be a supplemental spending bill probably where there's a little bit of funding that was left over from the fiscal year that they might want to reallocate to some various issues. And so there's a lot that could get squeezed into those days. So they can get really, really long, really quickly.
Yeah.
And that's why I think the next 2 weeks is the ideal time to reach out to your lawmaker, get on their radar before they're, jam-packed with legislation. They got to be a mile wide and an inch deep on a lot of this. And they'll listen to you if you're a content matter expert. If you say, hey, here's the industry I work in, or here's, what my family's done for a lot of years, and here's why we're passionate about this issue and think that you should either be for or against something like that.
Yeah, and that's important, empowering your voice with your state legislature, your state rep, and your state senator. Again, you can go to Michigan Hospital Association, find a way to communicate with your respective representative. A follow-up question real quick before we move on. So the process, the governor still has to sign anything that's passed by the legislature, right? And is it still the same rules, like 2/3 majority or majority, not so much 2/3, but majority, and the governor still has to sign it? So even if the legislature wants to push something that's harmful, like this staffing ratios or 340B, doesn't it have to go through some accountability process?
Yep, it would have to go through both chambers. So it would have to go through the state house, which is 110 representatives from across the state, and the state senate, which has 38 state senators, and then you have to have the governor to sign it, right? And so one of the sayings we often have is you need 56, 20, and 1, right? So you need a majority in each chamber, plus the governor has the ability to sign or decline to sign, which would be a veto of legislation. So there's a lot of checks and balances to it, but in a lame duck session, it can get really crazy.
And the governor, of course, can issue any executive order that she wishes to issue. Do you find that during lame duck, the governor is actively involved in executive orders, or is that just their prerogative throughout their career?
That's usually a prerogative throughout their career. We typically see less of those in a lame duck session, more of those early on in a term. A lot of times when they're doing reorganizations or like what we saw during the pandemic, there were a significant amount of those orders issued.
Excellent. So 2 major issues that we're facing as a community hospital that, as our listeners out there, it is going to be the nurse staffing ratios. We provide safe care here at Hillsdale Hospital. We also have a need for nurses. So to compound that with mandating that I hire additional nurses that don't exist would mean taking beds offline, which means a lack of access for care. So be a voice for that. The other issue that Adam shared was 340B. And I'm not going to get into all the specifics about 340B because we'd be here for a very long time. But it is a way in which hospitals receive reimbursement for providing needed drugs to you and your family. And at the end of the day, if the government tries to strangulate that, our ability to provide those at a discounted rate, our ability to offer that to our community, which is comprised of 70% Medicaid, Medicare, and government payers, 70%, would stifle. And so we encourage you to be a voice for us. They hear from me all the time. In fact, they're probably tired of hearing from me. And they hear from Adam all the time. They see him coming, they're like, oh, not that guy again. But at the end of the day, you're voting for them. They're in your district. You're in their district. You have relationships with them in church and whatever it is. And we want you to leverage those relationships because we need your voice in these two particular areas. So please be that voice for us, Hillsdale Hospital, as well as when you're a voice for me, you're a voice for all healthcare around the state of Michigan. So let's transition a little bit into some of the work that MHA has been doing. Adam, you've been busy. Not only are you dealing with, fighting all of these type pieces of legislation, but in advocacy, that's a lot of work because you keep your eye on the ball, sometimes far in advance before even myself as a CEO even sees issues trending. Give me a victory that you feel we had in 2024 from the MHA and some of the advocacy work that you've done.
You're going to limit me to just one? Look, I think there's a victory in a variety of areas. I think one of the top ones would just be Medicaid funding in terms of making sure the legislature understands the importance of properly funding Medicaid. That's the safety net health insurance program for our most vulnerable residents. A lot of folks forget that, roughly half of the individuals who walk into hospitals are Medicaid and Medicare recipients, and hospitals are price takers. We don't get to negotiate the price for them of what we receive for providing services for those insurance products. And so the state level, that's a big piece. We make sure we're educating lawmakers of we've got to make sure that Medicaid's adequately funded to ensure access to care. The other thing, and this really goes back to the workforce issues, are trying to get at the violence against healthcare workers. We know healthcare workers experience violence significantly higher proportions than other professions. And we were successful this past year in having the legislature pass legislation to enhance the penalties for assaulting those healthcare workers. And finally recognizing that, hey, healthcare workers have dangerous jobs and they need protections for those jobs. And the law can help provide that. And then going forward, the focus we really want to make on behavioral health and maternal health going forward. Those are key pillars for the MHA and our strategic action plan. And that, I think there's, with the change in the legislature, there's a lot of bipartisan opportunity there. There's not, especially on maternal and behavioral health, folks on both sides of the aisle agree we need good, adequate behavioral health services in the state. We need to make sure that people aren't languishing, waiting in the emergency department to access those behavioral health services, and make sure, obviously, that we have healthy moms and babies.
Adam, it's always a pleasure to talk with you. But before we close, I want to give you an opportunity. What's exciting for you? What are you looking forward to in 2026 as it relates to your job and some of the things that you get to advocate for? What are you looking most forward to? Could you share with us some insight into that?
It's a fun job because I get to work on so many issues. And the depth of issues that impact hospitals are extremely significant, right? We have the normal healthcare issues that impact hospitals that everybody thinks about related to those delivery of services. But people forget that hospitals are oftentimes the largest employers in folks' areas, whether it's the geographical area or the legislative districts. And so those things that impact large employers are going to be a focus. And I think a lot of it, when we look at making sure that we have an environment that's friendly to large employers is going to be one of those top things that we fight for. But I think at the short term, we're just looking at surviving lame duck right now, JJ.
Yeah, I know it. So we'll get through lame duck, which we will. You've done that so remarkably well over your career. I want to commend you for your ability to be a voice for healthcare, which is a voice for the community. It's for every one of you watching. This guy right here goes to work every day for you to ensure that we have safe communities. And that is something that I want to say thank you both to you, Adam, and to the association for the work that you pour into this each and every day. You have made such a tremendous impact. I know that it's a lot of hard work. It's a lot of wrangling. It's a lot of long nights, a lot of crazy dinners, I'm sure, that tear you away from your family because you got to deal with that. But really, just thank you for your commitment. And thanks, to the leadership of Brian Peters with the Michigan Hospital Association. Got a chance to get to know him over the years, and a remarkable leader. But what makes a great leader are great employees like you, Adam. And so thank you for the work that you do as a team member each and every day to contribute 120% to the organization, which uplifts Hillsdale Hospital and our greater community. So thanks for joining us today.
And I got to thank you, JJ. I got to thank you for being such a strong voice for rural healthcare. There's a lot of offices that I go into to meet with them, and they say, no, I already talked to JJ about this. I know exactly what you're going to say.
Well, I did text Marino today already. So
yes,
just FYI, we're communicating, but truly, I know the work is oftentimes, overlooked because it's just so much. And so, we just think that these things happen, but they happen because we have people in the background that are helping tell the narrative and the story. We can't all make it to Lansing. We all can't make it to DC. And that's where you come in. So thank you for your service. We appreciate it.
All right. Thank you, sir.
I don't believe we have any questions, Kirsten. That is true. She just informed me no questions. So Adam, you successfully answered all the political questions of the day. And we're going to should close in prayer on that note, right? But to close, we want to thank you, our community, for your continued support. If you want to connect with us more, you can go to our website at hillsdalehospital.com. There you can nominate a healthcare hero, someone who's done a great job for you. They can get the Patient Care Award. Support our capital campaign. There's an opportunity to do that as well. Make a financial contribution as you're looking towards the end of this year to make a donation. Or you can even learn about volunteering here at Hillsdale Hospital. Plenty of opportunities. Or perhaps you want to join an award-winning workplace in the state of Michigan and in healthcare. And we're going to release that in a few weeks about some state recognition that we just received, which I'm forbidden to talk about right now, but you'll hear more about that in a few weeks. And don't forget to check out our national podcast, Rural Health Rising. So wherever you subscribe to your podcast, make sure to subscribe to Rural Health Rising. We talk a lot about issues impacting rural communities just like Hillsdale. And then, of course, every week, WCSR and 92.1 and Buzz Radio, we talk about some of these very issues impacting healthcare in your very community. So I look forward to seeing you back next Wednesday. And hopefully by then you've had an opportunity to listen to our radio program and our podcast. But until then, stay safe, stay healthy, and stay Hillsdale strong when you use Hillsdale First.